I personally think it's very important that the surgeon and the patient have a good rapport. That works both ways. The surgeon must like the patient and the patient like the surgeon. In my opinion, this is the best indicator of a successful outcome. I'm Phil Guest, I'm a consultant facial surgeon in Bristol, and I've personally performed thousands of facelifts. When you're choosing a facelift surgeon, in order to get a successful outcome, you must choose someone with expertise and experience. That means someone at consultant level who can undertake the full range of surgical reconstruction and cosmetic procedures. In my case, as a consultant, I undertake the full range of facial reconstructive surgery after cancer surgery or trauma and the correction of facial deformity, as well as cosmetic facial surgery. Many patients find personal recommendation from a family member or friend who has been operated on before as a very useful way to choose a surgeon. If you know someone who works in the local hospital and knows a particular surgeon, it's a very useful source of information which you can use. Obviously, there's a lot of information available on the internet about various facelift surgeons, which is very useful. For instance, we have an open, unedited forum on our website which you can look at, where hundreds of patients have given their opinions about the service which they experienced. The opportunity to discuss facelift surgery with previous patients is both useful and reassuring, and we encourage this. You may get the opportunity to see a patient who I've operated on the previous week, who will be returning for the removal of sutures on the day of your consultation. Alternatively, we can arrange for you to speak to patients by telephone, or if you visit our website, on the forum you can contact patients directly or just see what they've had to say about us. The Department of Health recommendation is that you should see your GP prior to discussing the possibility of facelift surgery with a consultant surgeon. I think this is good advice if your GP happens to know about facelift surgery. I personally have operated on many of my friends and local GPs and fellow consultants and their wives who openly admit that they know nothing or very little about facelift surgery. Should you see more than one surgeon for advice prior to having a facelift? I'm very comfortable if you choose to see as many surgeons as you want to. The important thing is that you choose a surgeon which you feel comfortable with, and also that the surgeon feels comfortable with you. So, how many facelifts per year must a surgeon do in order to maintain their competence? Most doctors would think a minimum of 20 in order to maintain their surgical expertise. I personally undertake more than 10 times as many facelifts as this. You should also choose a surgeon who's happy to discuss with you the associated possible risks and complications, how frequently they may arise and how they're dealt with. In my opinion, these are the most important considerations when choosing a facelift surgeon. At the end of the day, you must meet the surgeon in whom you're going to place your trust, and you must make sure that you have a good rapport and that you both get on with each other. If you want to meet me, then please contact us using the information shown below.